whole body rash and fever are difficult to diagnose even for experienced doctors, because in many cases rashes can be similar and the cause of the rash can vary from mild conditions to life-threatening conditions like meningococcemia or toxic shock. Whole body rash and fever are strongly associated together. 80% of the time when a person has a systemic rash, they also have a fever.
So 80% of rashes are caused by infectious agents like bacteria or viruses. The other 20% can be due to drug reactions or autoimmune diseases. A rash is a visible change in the skin. It can be the color, texture, or appearance of the skin. It can present as red spots, bumps, patches, blisters, or peeling skin. A rash signals that something is wrong in the body, much like a fire alarm warns of danger. Just as an alarm may indicate minor smoke or a major fire, a rash can range from harmless to life-threatening. I will tell you the top 7 causes of whole body rash and fever. The first ones are most common, but the last ones are most important. That's why stay with me until the end of the video. Also, at the end, I will tell you what are the main treatment principles for each condition. So stick with me until the end. Before we begin, please show support for the channel and please like the video and subscribe to the channel for more interesting and useful health videos. Also, write down below in the comments your experiences, what rash you had, how you described it, and what was the diagnosis.
The first and most common cause of rash and fever is measles. It is a highly contagious viral infection which spreads easily, especially among children. Measles doesn't start with a rash, so the first symptom is not rash. It starts with a high fever and the 3 C's, which are cough, coryza, also known as a runny nose, and conjunctivitis, which means red and watery eyes. Also, Koplik spots are a hallmark of measles. They are white or bluish spots with red halos in the mouth, on the inner cheeks. They appear 1 to 2 days before the skin rash and are highly specific for measles. The rash appears several days after the fever starts, and it begins on the face and behind the ears, then spreads downward to the trunk, arms and legs. Maculopapular means that the rash consists of flat red spots called macules and small raised bumps called papules. The rash is reddish or brownish. It lasts around 6 days and fades over time in the same order as it appeared. Even though measles will be recovered without problems in 90% of cases, it's still risky, especially for children, and can cause death in 1 to 2% of cases. The infection can spread into the lungs and cause pneumonia. It can also spread into the brain and cause encephalitis, which can be very serious, or years later can cause panencephalitis, which is a deadly complication of measles.
Vaccine protects from measles more than 90% and usually lifelong. And if a person already had measles once, they have 100% protection from measles their whole life. Rubella is the second most common cause of rash and fever. Generally, it is milder than measles. Rubella, also called German measles because it was first described in Germany in the 19th century. Rubella looks like measles but has a short and milder duration. I think that's why it is called 3-day measles. But rubella is particularly dangerous for pregnant women because it can cause serious, severe congenital defects during the first trimester. Rubella is also transmitted via respiratory droplets like measles. Rubella usually starts with a rash, maybe accompanied by mild fever, tiredness, and swollen lymph nodes. But unlike measles, rubella has no such prominent start like high-grade fever, conjunctivitis, runny nose, and cough. This rash occurs because our immune system answers viral particles by inflammatory reaction and immune complexes deposit in the skin capillaries, which leads to local inflammation and causes pink and red spots. Usually, it is more immune reaction rather than direct viral damage. These red spots don't merge and do not create larger areas. It's also distinct from measles. It is called a non-confluent rash. Generally, it's difficult to say only based on rash if it's measles or rubella because they look like each other. But if symptoms start with rash and enlargement of lymph nodes, especially behind the ears and at the back of the head, it is rubella. If before rash there is fever, cough, runny nose and conjunctivitis, it is measles. The third most common cause is Roseola. It is a mild infection which is caused by herpesvirus 607. The disease occurs in infants and in children, usually under 3 years old. Before rash, sudden fever occurs, which is high often more than 39 degrees Celsius or 102 Fahrenheit. Despite such high fever, the child may remain relatively active. And this fever lasts for 3 to 5 days and stops abruptly. Then the rash starts. The pink maculopapular rash starts on the trunk and spreads to the neck, extremities, and also the face. The rash is non-itchy and fades in 2 days without peeling.
This disease is usually mild, but rarely febrile seizures can happen due to rapid rise of body temperature. Mild cold-like symptoms also can be presented with irritability and enlarged lymph nodes in the neck. The fourth most common cause of rash and fever is scarlet fever. It is a bacterial infection, different from all the above mentioned ones, which were of viral origin. Scarlet fever is caused by group Streptococcus, the same bacteria which causes strep throat. Scarlet fever is common among school-aged children. It starts suddenly with sore throat, fever, and headache. Lymph node swelling is also common. After 2 to 3 days, rash appears, first on the trunk, and then spreads to the neck, groin, and limbs. The tongue develops a white coating, then becomes red and gets a strawberry appearance. The strawberry tongue is the hallmark of scarlet fever, which happens because of the response to toxins released by the bacteria. Scarlet fever is called scarlet because of its scarlet red rash, so because of its bright color. After several days, the rash fades and skin peeling occurs. This is called desquamation. Treatment is required in many cases because untreated scarlet fever can cause rheumatic fever, heart and joint damage, post-streptococcal glomerulonephritis, which is kidney inflammation, and sepsis in severe cases. This bacteria with different strains can infect a person several times, and currently we have no vaccine against scarlet fever.
The fifth most common cause is drug-induced rash, which is caused by different medications. Usually, such drug rash occurs after 2 weeks from medication intake, possibly earlier also, and the rash is itchy, starts on the trunk and spreads to the limbs. The rash resolves within 1 to 2 weeks of stopping the offending drug. Such medications which can cause reaction usually are antibiotics like penicillin and sulfa drugs, anticonvulsants like phenytoin and carbamazepine. This is more common in immunocompromised patients like those infected with AGO. Usually, drug rash doesn't cause fever, but in rare cases it's possible. And now, the promised most important causes of rash, which require immediate medical attention, such as meningococemia, which is a life-threatening and fast-progressing condition that leads to sepsis and organ failure, and death within hours if left untreated.
In this case, rash is with petechial or purpuric, fever is high, neck stiffness, confusion, and rapid progression of symptoms. Myalgia and weakness are common. If left untreated, death risk is 50%, while with treatment, death risk is less than 10%. Meningococemia is caused by bacteria Neisseria meningitidis, which is also called meningococcus. This bacteria releases endotoxin. It leads to multi-organ dysfunction, hypertension, and shock. It causes uncontrolled clotting and bleeding, called disseminated intravascular coagulation. And rash is not because of inflammation, but because of bleeding under the skin. It is called petechia or purpura. Petechia are small red spots and purpura are larger ones. They do not fade when pressed. This test is called the glass test. When pressing the rash with glass doesn't make the rash fade. Such type of rash already indicates that bacteria is spreading in the blood and requires emergency treatment. The second most important and common cause of rash and fever at the same time is rickettsial disease, also called Rocky Mountain spotted fever. It is caused by bacteria Rickettsia rickettsii and spread by tick bite. Most cases are in the United States, but possibly reported in Europe, Asia, and also
key characteristic of the disease is rash starting on wrists and ankles, spreading centrally. Without treatment, high death rate, up to 30%. With treatment, most cases are fully curable, even in children. In this case, rash spreads to palms and soles also, which is uncommon for other types of rashes. And last is dengue fever. It is a viral infection which spreads by mosquito bite. Dengue is common worldwide in tropical and subtropical regions. The disease starts with severe headache, muscle pain, joint pain, and back pain, nausea and vomiting. Skin redness on the face. After several days, a person may have a sense of false recovery. Rash usually occurs on the 3rd to 5th days of illness and starts on the trunk, spreading to the arms, legs, and face. This rash is also petechial, tiny red dots that don't fade with pressure, and reflects thrombocytopenia. Now, let's talk about treatment.
For measles, proper hydration, acetaminophen for fever, and vitamin as supplements help with recovery. Full cure rate is more than 90% in case of measles. Rubella, no specific treatment is needed. Antipyretics and hydration are enough. Full cure rate is almost 100% in rubella. For Roseola, supportive care is enough. Aspirin is not used due to liver intoxication risk in children. Cure rate is almost 100%. For Scarlet Fever, antibiotics are needed like penicillin or amoxicillin to prevent complications. With treatment, recovery is almost 100%. Risk of complications without treatment is 1 to 2%, like rheumatic fever and kidney inflammation. For drug rash, discontinuing the offending drug is crucial. For symptom care, antihistamine or corticosteroids in severe cases. For meningococcemia, treatment is intravenous antibiotics like ceftriaxone. Supportive care for shock and organ failure. For rickettsia, treatment is doxycycline. Even in children. For dengue, hydration and supportive care. Avoid non-steroidals due to bleeding risk. Thank you for watching. If you like my video, please make a like and subscribe to the channel for further interesting videos.